Good morning, everybody. Happy Monday. So today I want to talk about chiropractic and knee pain and why we love seeing people with knee, well, we don't love people having knee pain, but we love seeing them because we can help them, and we often do help them with knee pain. So when somebody comes in with knee pain, there's a couple things that we want to check, or that we do check right off the bat. And one is we need to make sure there's no structural problems going on, like there's no torn tendons, ligaments, meniscus injuries, things like that. So once we can rule out all of that information, we take that and, I do a very specific motion analysis of the knee, because oftentimes, just through walking, stepping wrong, coming off a stair step, off the curb, just doing like maybe you just tripped over something just a little bit, but it wasn't enough to actually, like, again, tear a ligament, things like that. But it's enough of a little bit of a trauma that can cause your knee to just biomechanically shift a little bit. So now all of a sudden your knee isn't going through its regular range of motion, and given enough time, that's going to start to, in essence, wear down and get a little sore. So what we do is, or what I do is, analyze the range of motion with the knee, see how it's working biomechanically, and then from there we just do some very light adjustments on the knee and to get it tracking and functioning better. And it makes a world of difference. We love seeing knees. And then after that, once we do get it stabilized in that sense, we'll go over some very specific strengthening things that people can be doing for their knees to help, again, stabilize the joint so this doesn't keep coming back and being an issue. And the other component is, I always want to make sure that the low back and the hips and the pelvis are working properly, because if those aren't, that is also going to throw off the biomechanics of how the knee actually functions. So there's a lot that goes into it, but just thought I'd go over how we can help knees, because we've been seeing a lot of people with knees lately. And this time of year with the snow and the ice and everything else, well, that's not surprising. So again, walking out there, be safe this year. But if you do have any knee issues at all, let us know. Be more than happy to check it out for you, help out in any way, shape, or form. But hopefully that helps out a little bit as far as, chiropractic and knee pain. Again, questions, concerns, comments, just mention those below. But otherwise, yeah, have a great Monday. It's going to be a wonderful week.